Hello, everyone, and welcome back to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. We are really hammering home.
As
wait,
you can tell.
wait for it.
Oh,
'Cause
no.
I got my magic bag, baby. Magic bags in the house.
Wow.
No one look. You can't look inside the magic bag.
It's an interesting.
I gotta find it.
Okay.
Well, the bag's camo, so
Okay.
you can't see it anyway.
I brought Thor's hammer.
Oh my gosh.
I thought it was
That thing is
I
so
thought it was gonna
cute.
be
Hammer
an access
home
to the
those
channel. It was gonna be
reviews.
like an inflatable one.
Is that like,
It's from like one of those action figures.
oh my gosh. It looks like a
It's
pretzel.
Thor's hammer. Isn't that what I
That's
said?
amazing. Do
That
it
is
on the wood.
I didn't know what I
Do
said.
it over there.
Ridiculous.
Hammer
Wow.
home those reviews. Let's
It's so
hammer them
sad.
home, baby. Bring them. Don't hammer it. Don't hammer the stand.
You can
Okay, so Duckwall.
It
Let
legit
everybody
looks
know.
like
It's
a
a little
pretzel
bent.
on
Listen,
a stone or a
should I
marshmallow.
throw it and see if it comes back to me?
Oh,
It's not a boomerang.
throw. I want to see how heavy it
Have you guys
is.
not seen the Marvel movies? Yes, he
Yes,
does. He throws
yes.
his
Oh, yeah,
hammer
that's
and it
true.
comes
Oh,
back.
yeah, that's true.
Throw
I
it to me. I
forgot
want to
about
see how
that.
heavy it is.
Does
Oh God.
is it
It's
is
a
it
piece
Liam?
of plastic.
Is it Liam or Chris?
Wow.
Chris. Does he come with it?
No, he doesn't
That'd
come
be
with it.
great.
Sometimes
There
Chris
is no
Hemsworth,
Marvel
coming your way.
superhero. Okay. All right, so hammer home those reviews. Duckwall, tell us where we're
Yes,
at
yes.
in terms of number of reviews.
He was looking-
We didn't gain any on Apple from last time.
What
Okay,
the
listen,
heck?
this is what I thought. I thought of after
They
we
just
had
don't
done
wanna
the
see me
peanut butter
suffer.
commercial.
Yeah.
Devyn needs to be lathered in peanut butter. She has to be laying on the ground with her scrubs, all, not like naked or anything. I'm just saying like with her scrubs on. Peanut butter on her arms and her face. She has to lay on the ground
Yeah.
and then we release the dogs.
Oh.
That's actually really
She would
funny
get
too.
Yeah, it would be great.
You get bit.
Oh,
She's not going to get bit.
no.
She's just going to get
Before
licked to
that,
death.
let's all don't
just
know
throw
that.
marshmallows at her so they
So they
stick, and then
stick?
put her on the ground.
Okay.
What if we just like cause a dog fight in front of her?
Okay.
Well, we'll
now
take dogs that
listen.
aren't food aggressive.
Yeah. They're going to be friendly dogs like Moose and Quill and
Can I cover my face?
Miles and Wade.
Miles and Winnie and
Just
they
for
all
my
get along,
safety.
right? They have
Your
to all
face?
get
Yeah,
along.
we'll get you a helmet.
we can get
of
you a
some
helmet.
sort.
Great.
Okay.
That's right. Okay, so
I'll
that's
wear a
one
helmet
idea.
covered
There
in
we go.
peanut butter.
For what
the
Devyn
milk
can
mile.
do.
I'll give you a
Still.
hard
We
hat
got to
and
get
some
to, what did we
goggles.
say
I
we
have
had to
the
get
milk
to?
mile. Oh,
100.
100.
Oh, we have the milk mile. We have now Devyn covered in peanut butter.
Yep.
And eating all the stupid food.
And yeah, eating the dog.
I
food.
really like
Ooh,
the
eating
dog
the
food.
dog food.
Peanut butter and dog food.
No.
And marshmallows. No, One all or on
the
your
other.
body.
It's a lot.
Oh.
All
Just-
on your body.
That's
But
Poor
hey,
Devyn.
we're at the 40 of Spotify. We're at 133.
40 was
Backwards.
2 weeks ago, people.
Backwards, 133 on Spotify,
Sorry.
40 on Apple.
Okay, yep.
I
And we
don't
need
know
to
what
get to
the
what?
goals were.
100.
I
We
think
need
it's
to
like
100 on
50.
Apple.
100 on
Oh,
Apple.
I don't think we really.
Because I
mean, we
remember
care about
saying,
Spotify,
I know
but-
we have 60 followers. I know we can get 60 comments.
Yeah, we didn't get any.
And we didn't get any.
Mhm.
0.
We gotta be better. We gotta be
Well,
better.
Devyn had a good point. Maybe they love her too much and they don't want to see her suffer.
Ooh.
Because we clearly,
Mm.
these punishments are not nice.
Okay. Good point.
Devyn's fan base coming to her rescue.
That's right.
Guys.
Exactly.
It's like the Swifties, but for Devyn.
I don't know what they'd be
The-
called.
What
the
can we call them?
Devies. They
The
could be the fortune
Devies.
cookies.
Oh, the fortune
that's
cookies.
my horse's little
Ooh,
show
the
name.
fortune cookies.
Wow.
I like
The
that.
fortune
Okay.
cookies for night.
Okay.
I don't even
Well,
know what I just said.
We'll see if people show up.
Let's see if they do.
Yeah.
Okay.
That was rough.
All right. Introduce yourself, ladies.
I'm Courtney. I am a technician. And that's all I got.
I'm not an artiste. You're not a colorer.
Boring.
Hit the fail button. I don't have
We
it.
don't have it.
He took away the fail button.
Why'd you take it away? I always use
He
it.
hates us.
It's rough. Yeah.
Okay.
So sad.
That's the fail.
There we go.
Okay, good job, Courtney.
He's going to dig it out of the box.
What do you want me to say?
I don't know anything. Literally anything.
I braided my hair today.
Wow,
It
it
looks
looks
beautiful.
Nice. That
See,
looks
there you go.
fantastic. There you go.
People don't know if they're not watching.
Oh, I did my own nails at home. I got a gel kit and I did my own
Ooh.
nails.
Did it work?
Oh, yeah.
Nice.
That's exciting. That'll save you money.
Yeah.
That's cool.
The whole thing was like $30 and a normal gel set is like 60 at a
Wow.
salon. And they look good. Okay, there's my fun thing.
They look great. Thanks.
For
Yeah.
taking 30 minutes.
Tinks.
And they match your sweatshirt.
Yeah.
I'm Devyn Fortune and I am a assistant tech in training.
Nice.
Yes. Oh, update everybody on your
Yeah.
pharmacy.
Oh, yes.
it was
my
farm.
what?
It was what?
Wasn't it just farm?
Yeah.
Not pharmacy, farm.
I don't know. Does anybody hear that?
They can't hear that on here.
That must be the ghost.
There's something meowing.
Dude. Oh, get the tissues.
Just for all you listeners, if you didn't watch the last one, watch it.
Them.
That was personal.
As an update, Devyn got really bothered by the fact that there have been cat ghosts in this hospital, and so
You can say emotional.
Dr. King, yeah, she got emotional. She cried. Just played a cat meowing in the background and gave her tissues. That is actually fantastic.
Is this supposed to be a cat? Because it looks like a wild animal.
Looks like an expensive
just to
cat.
protect your ears, so you don't.
Oh my gosh. Why do you have
On this
these?
podcast,
Those are for you.
those are for you.
Sons.
I know. I had to buy those because clearly I don't have.
That is fantastic.
There you go. Now you don't have to worry about hearing those scary sounds.
What?
love
Yes, my pharmacy final. I got my grade back, my proctored final, and I got a 99.
So you just missed the one that you told us?
Well, I
99,
thought I
way to
knew
go.
that I got one wrong, and then I got one vitamin wrong, but they won't let me see what I
Oh,
got marked down on, so I don't really know what I got wrong.
okay.
But I'm happy.
But she got a 99. That's pretty cool.
good.
That is pretty good.
It's always
That's pretty
annoying though, like
amazing.
when you
Yeah.
miss one.
especially
Good job.
pharmacy.
Thanks.
I'm Ashlyn Duckwall. I'm a veterinarian. I'm just trying to make it through the day without coughing, and it's not working.
You're doing pretty
You're
good.
doing great so far.
Okay, thanks.
Here, I've got things for you too.
Just got a cold, residual cold. Yes.
Everybody should take some.
I'm being one upped on
Oh,
the magic
System
bag.
defense.
Yes.
Take some of that.
She just
Devyn
gave
has
me
gotten her
Hall's
magic bag privileges revoked.
immune defense.
by me.
And
Cough
here's
drops.
your other.
Yes. You know I love surprise gifts.
There you go.
Yes.
See,
Those
look
are the
at
best
that.
kind of gifts.
Okay,
These
thank you.
earmuffs
I
are
just got
pretty
some
warm.
cough drops, which is appropriate for why I said what I
Yep.
said.
Excellent.
We're doing it. I'm here. I'm
Okay,
here.
You're
That's
here.
all that matters.
And your
What's
butt's in the
gift?
seat.
That's
I
right.
get earmuffs and a ghost. Duckwall gets cough drops. I can't wait to
It's
see
not
it.
time for mine yet.
No,
or
no,
maybe I just
I'm
don't get anything.
I just can't
That'd
wait
be
to
okay.
see.
I'm Emily King, Dr. Emily King, and I was in charge of the magic bag today.
And you're
Okay.
doing phenomenal
she
so
is-
far.
Okay.
Yeah.
Awesome sauce.
She's doing amazing.
See?
Is that supposed to be a meow?
I think so.
Again, for all those not watching and listening,
What?
Courtney is holding up a stuffed cat.
That does not look like a cat.
It looks like an alien, and she's pushing the button.
Oh, okay. Stop it.
I hope that
I'm
this
gonna have
can be heard.
nightmares.
That
I
is
gave
quite
you the head
creepy.
muffs for a reason.
That does look
Headmuffs.
very scary.
Oh my god. That sounds like
gosh.
come out of that thing. You're not normal.
All right. If you could replace the handshake, what quirky greeting would you invent?
Ooh.
Courtney. Or Devyn, whoever.
I don't
It's
have
not-
anything.
The hand snail.
Oh,
Okay, what's the hand
snail?
snail?
I love hand hug.
We start as a fist.
Hand hug.
I'll do the snail part. Okay.
Okay, now do mine.
Hand turkey?
No.
Oh.
No, I like that one. Hand hug.
No, it has to be opposite hands.
Oh. Oh, you
didn't
like
count each
Oh
other.
my gosh, those are really dorky. Okay, nobody should do those. If
Those
you
were
watch,
Hey!
don't ever do those.
Am I talking loud?
Yes. Okay, wait. Where did you come up with those?
life.
Oh my gosh,
It's
those
the
are actually
wisdom.
real
Living.
things. Those are things people actually
Yeah,
do.
You've never done a
What
hand
would, you,
hug?
what would you do?
No.
Do you want to experience your first one with me?
No.
Why not?
It'll
Okay.
change your life.
It'll make you feel. You have to hold it for 30 seconds to make yourself feel happier.
Wait, hand sanitizer.
I'm not contagious
Okay,
anymore.
listen. There is something about oxytocin being released when. That's why people, like
You hug,
athletes, give
yes.
high fives because.
Oh,
What were you going to say?
I was going to say you have to
Yes.
hug for 45 seconds.
Yeah, because that's the
That's a really long hug.
feeling or the not drug.
Endorphin.
Thank you, or
Mhm.
something that's released when you do that, and so then that forms bonds and it creates trust.
What's
Fun
your,
fact of the week.
What's your
There you go.
quirky thing?
Mine
Yeah.
would be more like a boom, boom, boom,
A handshake.
Like a full on. Oh.
Yeah, that.
Wow,
Okay.
knock
You know.
someone out.
Yeah.
Your
That was some
movements.
punches there.
Yeah, it would be like that. It would be like one of those. Like,
Hey, well, passed out.
You
Yeah.
know.
Oh my.
Just
We are
start
on
knocking
one
people
today.
out.
Did you snort?
It's these stupid earmuffs.
Oh goodness. Okay.
If animals could talk, which would be the rudest? The giraffe, because it's always looking down on you.
Okay.
Somebody read these questions beforehand.
I had
No, I literally thought that as soon as I read that, I was like, the giraffe. Because it's always
like
like
what
a
was I like
down.
the logic
animal you
behind
saw
that.
She's crying.
Well, my first one was basic. Do you
What?
want tissue?
Yes. What was the first one?
It was just a cat because they're always like
Oh,
They're
yeah.
so
already
judgmental.
temperamental.
They are.
But then I looked it up because I was just curious what other people had to say, and they said seagulls because they're already rude, and I kind
Ugh.
of like that.
Seagulls?
Yeah,
They steal
They
your
are
food.
rude.
They have no respect for anything.
Yes.
At all.
They are. It's all about them.
but I'm
It
sticking
is.
with cat.
I
But
don't know,
that's
I
how
kind of-
cats are too.
Feel
Well, that's
bad for
true.
them. They're just trying to survive.
They can fly
Seagulls.
wherever they want to be.
A couple years
They
ago
can
on the
go.
beach, there was a one-legged seagull, and we just kept feeding him French fries. And he was fighting the other ones for the French fries. He did pretty good,
Sad.
but he only had one leg.
What's your opinion?
I mean, I'm not really thinking like a lot of animals. I think cat though. Yeah,
I said sloth.
The rudest?
Well, because
They don't even
everybody's
have, like-
passing them by. They're moving. So
I don't. It would take them like 7
They
years
can
to
see 'em.
even say
I
something.
was saying out somebody like you.
Throwing up the middle finger would take 10 years. Or the
Please.
thumbs down just very slowly.
They're mad
makes
because
it
everybody's
worse.
moving faster than them.
Yeah.
So I thought they'd be the rudest.
It would keep me on the edge of my seat if they're going like this and you're like, is it going to be thumbs up? Is it going to be
Give me
thumbs
thumbs
down? Oh, it's going down. It's going down. Oh.
Oh my god!
Interesting.
That's good stuff.
Good stuff. Good stuff. Good stuff.
Let's
All
do
right.
a whole episode where we just ask each other questions.
Okay.
I'm all down. Or I don't know. I'm for it.
I didn't get a present.
It's coming.
You get a
just kidding.
cat.
You played with your kitty over there.
All right. Case collections. Let's hear what you guys have.
It vibrates.
It's
Okay,
supposed
Court,
to
you
be
go
purring.
first.
Okay.
No, it does vibrate.
It's purring. Don't cry. Here, give me the vacuum. Put it over here. Okay. Anyway, case collections. So we had an 11-year-old neutered Labradoodle. He presented for not acting like himself.
Oh boy. Someone's got to take the batteries out of that.
Give me that cat. I'm going to give it some GABA. Sedate it.
He presented for not acting like himself. He was constantly pacing at home, yet lethargic. He was drinking a lot of water, more than he usually does. He refused his breakfast as well as any kind of treat, which is very unlike him because he's never missed a meal in his life. He did vomit once, but otherwise his stools were normal, everything like that. So we started with some workup diagnostics. So first we did blood work that showed mild neutrophilia, azotemia, and mild hyperglobulinemia. I'm not good at saying that word. His USG was 1008. His chest res were unremarkable. We did do an abdominal ultrasound because at this point we were kind of just looking for anything. And that was pretty unremarkable. We found an incidental splenic mass, but that was not causing his symptoms that he presented for. And then he did have a temperature of 104.2, which is extremely high, not normal. And so we were kind of going through the list of what could possibly be going on. And one of the first things that comes to mind is a tick-borne disease or virus. But the owners did not want to do that at that time. So we did not do that PCR. And then on exam, he was very, very weak and couldn't hold himself up for very long. His eyes were also sunken in. So after discussing everything with the owner, and like I said, they didn't want to do the tick-borne panel, we decided to just treat for a fever of unknown origin. So what that included was hospitalization on IV fluids. We did a IV antibiotic, which is Unison, and then we gave him Cerenia. We did multiple doses of each medication. And we kind of just continued to check his temp, make sure it was going down. The first day he was here, I don't think it really moved much. I think it went actually up a little bit and then started to drop, but it was never normal that day. And then the next day it did start to drop a little bit more and kind of go into the normal range. But he was still, I think he normally runs high, but I think when he left it was in like the 102.3 or 4 range, which is technically normal, but it's high and normal. So like I said, after he was here on fluids, he started to improve. He kind of perked up a little bit. He started eating for us. And so therefore he was eating. So we felt comfortable sending him home on oral meds. And so the owners took him home. Like I said, he got better at home progressively. He started eating, acting normal, playing with his toys, things like that. So I think he was here for almost a full 2 days. Is that right? Yeah, he was here for 2 days. He went home on the second day towards the end of the day. So he went home on December 28th, and he actually came back on January 1st for a splenectomy due to that incidental splenic mass that we found. And now he's doing fantastic.
Which came back as a negative, well, not negative, sorry, benign hematoma on the spleen. So with those, it unfortunately is 50-50, but they still all have the risk of rupturing. So owners are very proactive, which I agree because it was pretty big.
Yeah.
And we took it out when he felt better. But the biggest thing with him was fever of unknown origin. It could be really anything. And so I did discuss with the owners, like going down that rabbit hole of diagnostics, which is not wrong. But for him, there was no history that would lead me towards doing one test over the other. And so we just kind of agreed to focus the finance and just commitment of treatment or to treatment to get him feeling better as opposed to knowing the why. And because he was responding, that was also a good sign of what we were doing was working. So if it wasn't working, then we would go back to that discussion of diagnostics.
Yeah. But he's one of our frequent flyers. And when he came in that day, I actually went and picked him up because his owners were out of town. And he wouldn't even get out of my car, which is very weird for him. And like Dr. Duckwall walked back to treatment and didn't even recognize him. That's how dumpy he was.
Yeah, he didn't look like himself.
He felt bad. But he's all better now. Yep. He's great. So
treatment is also a way... what am I looking for?
Like of diagnosing him?
Yes. Yeah. That's kind of how we approached it. So.
Yeah. I think
he's all better.
That's awesome. That's awesome. I think there are so many instances. I think we've talked about it before too, where like you're working up something else and you find something else, and it's like kind of like a blessing in disguise.
I agree.
And you can, actually, the more pressing problem is the secondary thing that you find just because the dog or cat came in for something else incidental.
I agree.
And so it's pretty cool that
I feel like that happens a lot with splenic masses. Not a lot, but I mean, unless they're ruptured, you don't really, or unless they're about to rupture, you don't really find them.
Yeah.
Like there's no reason to just do an abdominal ultrasound for fun.
Right.
So I think, so I'm really happy because I think it was 6 centimeters or 6 millimeters, something like that.
It would have been 6 centimeters.
Yeah.
Yeah. And I think that, I mean, it's just fascinating. It's just fascinating how often that happens where, and to Duckwall's point, you don't know when you're looking on ultrasound because hematomas and hemangiosarcomas can be destructive in nature. So you don't know which one it is, but they're what we call ticking time bombs. So eventually it's going to cause a problem. So it's much better to be proactive while the animal's in a good place physically to be able to do surgery, remove the problem, and then they can move on about because they can live without their spleen.
Like if the animal's healthy enough, take it out. So it's not a problem. So then you don't have to just sit there and wait for something bad. I mean, something bad might happen. So
cool.
Yeah, he's all better now. Yay.
That's awesome.
Okay, I can go.
Yeah, go for it.
Okay. So this is my cat. He is a 6-year-old domestic short hair. And he's kind of had like chronic reverse sneezing for most of his life. So it started in 2020, December of 2020. So 3 years ago. He just started reverse sneezing out of nowhere. I brought him in, and then we did a round of doxycycline and started him on lysine powder. And then he improved on the doxycycline, and he lasted like a few months with it out of his system, but then his reverse sneezing came back summer of 2021. So I brought him back in. We did another round of doxy, and then recommended a sedated oral exam to look for polyps. So same thing with the doxy, he improved, lasted a little while, brought him back in. We ended up doing a core, so a dental procedure, and then just look for polyps there. And we did not find any. So from there, I'm kind of a crazy cat mom and I want to do everything. So no polyps. So we went forward with thoracic radiographs to look for asthma or any changes. No changes, no asthma. So I did a upper respiratory PCR panel on him, and that all came back negative.
Okay.
So after trying so many different things, because it wasn't affecting his quality of life at all, but it was bothering me.
Sure.
And he would like sound congested, so I just wanted to make sure it was fine. But we started him on Cyclovance. He's probably been on it for like a year now. He's doing wonderful. Like I gave it to him consistently for probably a month, and then I slowly weaned him off of it, and now I only have to give it maybe once a month. Like if he starts flaring up and reverse sneezing, I'll give it a couple doses in a row, but
So you think it's allergy related?
Yes.
Yeah.
Yeah.
So rhinitis, like just secondary to allergies.
Yeah.
Fascinating.
So my allergy kiddo, little kitty.
Oh my gosh.
Yeah. So I'm glad that we finally figured it out.
Well, and what you did was rule out all those other things.
Oh yeah, it always makes you feel better though to know that there's not something more serious going on.
Yeah, for sure. That's cool.
Yeah.
And so how often do you have to use the Cicalese?
Probably once a month.
Oh, okay, so not very often.
Mm-mm.
Okay.
And it doesn't seem to flare up like during certain seasons, because the first time I brought him in for it was December, and then like it was the same thing in the summer. So it's not like only bad during spring or fall.
Right.
It's just kind of. So it's interesting. Yeah. Maybe it's something in the house. I know. Maybe he's allergic to your other cat. Maybe he's allergic to me.
Could be.
Too bad. Sticking
That's right.
with me.
Exactly.
Got a whole life together.
Too bad, Walter. Walter?
Yes.
Oh,
What did you
gosh.
talk about sneezing?
Yeah, it's reverse sneezing. And I was doing great on Cyclovance.
That's so good.
Yes.
It's good because some cats don't do as good. So
Yeah. I was telling them I only have to give it like once a month now.
that's really good.
Mhm.
Oh, see, that's a happy story with
There you
that
go.
Yes.
disease because I've had a couple kiddos that just,
Mhm.
it's
Chronic.
the infection.
Oh.
It's the secondary infections
Yeah.
they get.
Yeah.
That is
Mhm.
just really annoying. So,
Yeah, he's doing wonderful.
no, Walter.
Okay, I will go next. I was going to give everybody an update on the cat that I spoke about, I think last podcast, where the cat it was a young cat that had pleural effusion. And by that, we mean free fluid in his chest. And so that cat unfortunately succumbed to the disease because you can't keep tapping the cat's chest to provide relief. And so, and at that time, the owners didn't have the means to continue with the treatment or diagnostic process. Right. So we ended up euthanizing him. But as we were talking about that case, Courtney brought up the fact that we've had a handful of cats in the clinic because we assumed that cat probably had FIP. It's the most common differential in a 7-month-old cat with pleural effusion. Mm-hmm. So then we were talking about treatment options for cats with FIP. And I think on the last podcast, we mentioned the Facebook group, the FIP Warriors, the Facebook group. And then you mentioned that you have a cat, right? Somebody has a cat, or you saw on...
I saw on social media.
Mm-hmm. Yeah.
There was a cat or a lady. So her cat, I think it's like between 6 and 8 months old. And he was diagnosed with FIP, and they did all the conservative treatment, everything just to make him feel better. And the vet she was going to at the time was just like, hey, there's really nothing more we can do, which is, I mean, that's usually the case with FIP. You do as much as you can and keep the animal comfortable and whatever. So they did that for a long time, and the mom, this cat was just like lateral. He wasn't doing anything. He wasn't eating. He looked horrible. And they were like, okay, you're eventually probably going to euthanize because the disease is just going to get to him. And this lady was like, nope, I'm not doing that to my cat. So she went and she did her research. She did find the FIP Warriors Facebook page. And she got there's a drug, I think, that they talk about on there. She ended up getting a dose of it. I think she gave a few doses maybe. And her cat is completely healthy, and he no longer has FIP. I mean, all of his blood works normal. He's eating again. He's playful. He's acting like a kitten. So I thought that was really cool.
Yeah. And
good.
One of our doctors also at the clinic has used it for 2 kittens that had FIP. And this drug doesn't have a name. It's like letters and numbers.
Yeah.
Yeah.
I don't know what it is off the top of my head, but it's like, I don't know, like IG532. It's something like that, basically. Like it doesn't have a name.
Yeah.
But it also isn't sold in the United States, right?
I legitimately don't even know where people get it.
So the Facebook page, the FIP Warriors, can get a hold of it. And so then that's why those are the people that are helping folks with cats with FIP. But we were in our doctor's meeting and we were talking about remdesivir, which is used in people for coronavirus. And there are some consultants that are using that now for FIP. Because now that it's FDA approved, now we could use it off label in animals. So there are some clinicians that are pulling that because the other product is not FDA approved. And so it's hard to get a hold of. Whereas this one, now that it's FDA approved, if your distributor can get a hold of it, then potentially that could be a product that could be used in FIP.
Are we seeing improvement? Is there much success with the treatment?
I don't think it's been
I think it is
not
like
much,
brand new,
statistics.
like from the standpoint of just, it's just because it was on emergency use only for people.
Okay.
So we couldn't get a hold of it.
Right.
And so then once it's FDA approved now, I think if you can get it through your distributor, then you could use it off label.
I'd be interested to see how it works.
Yeah. So Ven, I think, had information on the dosing, and they were talking about it on Ven. So that's what we were talking about in the document.
Still a risk to doing either one, but honestly, it's better than the alternative that unfortunately these kitties don't really, it doesn't end well.
Well, you have no other, I mean, there's no,
right.
There's
That's,
nothing
yeah.
to do.
Yeah, you can do
You just
anything.
do what you can.
Yeah. So
I do have a case. I was going to talk about a dog named Charlie. She's a 2-year-old lab mix, and I saw her a couple weeks ago for hair loss. Just essentially just diffuse alopecia on her limbs, her belly, all 4 limbs. And she had an episode of this back in the summer and saw a different doctor here and was worked up for allergies and ended up responding. They tried Apoquel. She didn't tolerate it GI wise. And so then they switched to Cytopoint, and it had been some times through that process. And so then she got the Cytopoint. Her hair was coming back. She wasn't like overtly pruritic or even licking a lot or anything though. And so she had responded to 2 doses of Cytopoint and then kind of went on her way. So then it started happening again just 2 weeks ago. And again, nothing in her history that's like allergies, is screaming allergies. She's on prevention. She's on Simparica Trio each month. So that helps minimize my concern for parasites and things like that. So the pattern of it is very interesting because truly her hair is flaking off, but there's no redness. There's not scaling. There's not like pimple type bumps anywhere. Again, she's not overly itchy or anything. So it looked a lot like maybe a follicular dysplasia, which is like an umbrella term for these different types of diseases or dysplasias of the hair follicle or the skin of the hair or the life cycle of the hair, if you will, things like that. So that I have that on my list. And then hormonal. So we checked her labs for thyroid or maybe Cushing's type changes on her blood work, and everything was normal. I still can't rule out thyroid, I guess, because we didn't do the full detailed thyroid panel. But anyway, that's still on my list too. So we ended up just jumping straight to biopsies because mom's in the medical field, and honestly, that's our best, quickest way to start to get a diagnosis. So we just performed those on Monday. I got samples and kept the hair so that the pathologist could look at it. So to be determined on what's going on. Yeah, I think a lot of times when it's just like a cosmetic thing mostly and the dog's not super uncomfortable, we may kind of jump along to different therapeutics or supplements or supportive care first. But I think I'm excited because we're jumping right to the biopsies. So
the owner said she did try melatonin, but it was only for like a week, and she was like, you know what, screw it, let's just
yeah. Well, she did come in being on melatonin too since the last episode.
Oh, gotcha.
And she was also on Benadryl for reverse sneezing. But that was it. So
okay. So she's been on melatonin for a hot minute. It's not doing anything. Her hair's still falling out.
Interesting.
Yeah,
that'll be fun to hear what the dermatohistopathologist said.
And I hope we get like a direct answer. We don't have to go.
We stand up to Texas.
Send it to Texas.
Yep.
Yeah. If you're out there and you're sending in samples, send them to Texas.
Yes. They're great.
They're
they're awesome.
It's very helpful. And pictures and whatever else you can send.
Yes. I sent pictures too. So we'll see.
Okay. Those are great
Good
cases.
cases.
Speaking of great cases, I got to get out my...
Oh my.
Good Lord.
Oh my.
Your bag is giving birth. Oh, that's Courtney's helmet. Put it on. You're all cat. Courtney, here. No, you wanted your gift.
Be the mother hen.
You wanted your,
There's a bottle.
gift.
Courtney, your case was king case. There you go.
Really?
Oh.
Here,
There
you
you go.
feed your kitten.
Feed your kitten.
Is this supposed to go on my head?
What is happening?
She's not even.
We have a fake
That
crown.
is just what the
We've
cat
got-
came
She
in.
doesn't
But
d-
you could
Ooh,
definitely use it as a Viking
oh.
helmet. Sure, why
She
not?
doesn't deserve it. She just
We can go
dropped
into
it.
war.
Okay.
I'll win.
Pets will be protected.
Cats are the rudest.
Oh my
Yeah, but
gosh.
I'm.
You with my
It's
I'm a
like we
king.
just gave 2 little
I'm a
girls like
king.
some
Toys.
Barbies to play with. And they're
Oh
just
my
like,
gosh. Okay.
Who wants the earmuffs? You wear them with your helmet.
Oh, that
It's
would
a
keep
full
your helmet
ensemble
on.
and feed your kitten. Your
Oh
ghost
my
cat.
gosh.
okay, here we go.
on to
Let's
the
move on.
listeners'
This is
questions.
what girls in school are
Okay.
doing now.
Go ahead, Duckwall.
All right. Hiya. I'm a 3rd-year vet student at the University of Glasgow. which is amazing in
That's very
Scotland.
cool.
Oh my gosh, I'm so jealous.
Scotland.
I am from New Jersey, back in the States, and am here for school. Why not travel while I get my dream degree? That's genius.
So amazing.
I have been listening to your podcast and following you on TikTok since I started vet school. I love your podcast so much, and I can relate them to my classes, which has been helping me understand the content better. Y'all make me so excited for this career, and I'm so grateful for your podcast. So I have a question for the group. In the UK, you have to, in all caps, sedate any animal for radiographs. Does not matter if it's an emergency or the age, you have to do it, as humans are not allowed to be within 2 meters of the primary x-ray beam, meaning patients are held into position with tape and sandbags. My question is, what is your opinion on this? How would you feel about sedating or putting under GA any and all patients that need a radiograph? At Michelle
Cicalese.
Cicalese.
That's what
I'm
I'm going
so
with.
sorry,
Yeah.
Michelle.
That's
Great
a
name.
freaking great question, though.
That is such
It
a great
is a good
question.
question.
So unique.
So I was thinking about this question. I was like, oh, back in the day, like digital x-rays are new, right? And well, new, like in terms of
Yeah.
multiple
Newer.
years.
Yes.
So when I was in school, they definitely sedated every single patient for x-rays. And that was the protocol. Everything had to be sedated.
Actually, yeah, they did it for me too when I was in school. Now I think about it.
And I don't know if part of it was, well, I think there's lots of reasons why people do it or why that's the recommendation, which would include things like better positioning, fewer x-rays. And so then fewer people exposed to x-rays are probably the biggest things.
Yeah.
Right?
Oh, I think that's hands
If you're
down
learning
the
how to
best.
position, it'd be
Yeah.
less stressful
Yeah.
for the
And
pet.
then, when you're taking, and the fewer the number of x-rays you have to take to get it correct was very advantageous when we had to use film. So back in the day, we had to use film and you had to send the film through a processor.
Yeah.
And if you had to do that 15 times,
Yeah. No
That's
kidding.
a lot.
it was a lot of freaking film. So they're like, get your animal positioned correctly. And so the only way to do that is to have the patient
Right.
sedated. So
I think when I was in school, I think the biggest thing is, one, it's also good for learning. I should say that with when you're in school for the students, just on where to collimate, where to, how to position them, things like that is probably
not
why
having
they
a
did
moving
it.
animal.
Mm-hmm.
Yeah. I think that, do you need something? Like
She
maybe
was just waiting for you to
a
cough.
little bit of mineral water with a twist of lime that's carbonated that might tickle your throat?
Topo Chico. A twist of lime.
Does anybody else need anything?
Well, what else
Topo
do you have?
Chico.
Do you need one?
Do you need a bottle?
It's only for
I
coughing.
don't know. I have no idea. I've never bought them, but they just
Are they
caught my
golden?
eye. And I was like, I wonder
I
if
don't
this would help
think this
Duckwall.
is twist.
Do you have a bottle of butter?
Someone got some sharp teeth.
Someone,
well,
someone
no.
help her. She's coughing. Okay.
I don't think it's twist off.
I think coming to the real world, it was like,
It says twist of
oh
lime,
my
not
gosh,
twist off.
some of these animals are crazy. And of course, our lovely technicians are the ones who are
Battling.
positioning them and
Mhm.
doing the x-rays. So it's like, I'm thankful that they're great to know like the level of stress, right? So
Right.
if the dog, it's too much or it's not safe for anyone, they'll call it and call us and say, we need drugs. Like
Yeah.
we need something to
Mhm.
calm them. But
So like luckily in here in the United States, we don't have like
Yeah, we don't
hard,
have that
fast
rule.
Dog dependent, animal
And I
dependent.
don't think it's practical in the everyday sense because of the added cost.
Added cost was going to be the thing that I said too.
Yes.
Yeah, that you can't do that to every owner.
No,
Yeah.
especially if the animal, like we have some great patients that will
Mhm. Yep.
not care
I've
at all.
taken extras by myself on an animal before.
Yeah, yeah. So it's doable without it. And so then it's like, well, why are you taking x-rays? What's the health concern?
We're still
What is
wearing
their age?
PPE. You know,
What'd you say?
we're still wearing personal
Oh.
protective equipment.
Yes, that is correct. Yes.
Yes, yeah, no, you absolutely do. But I still think the safest thing is to not be
Right. Not be
Not
there.
there.
in the
Oh,
beam.
yeah. When we have sedated patients, we don't even leave the room. We're
right.
still in the room.
Yeah.
We're taking the x-rays.
Oh,
Because she was saying
monitor, make
to
sure
you have
they're
to be
doing
away
okay.
from them.
I see.
Which I
Yeah.
guess, I mean, for 2 seconds, it's fine.
But I mean, you walk around the door and push the button.
Yeah.
I mean, so you tape the patient in
Mhm.
and then
Yeah.
Yeah.
you walk around the door, push the button, walk back in, and then, get the next film.
Yeah.
But it used to take so much longer. with the-
And I
with
mean,
film
like, there have to
processing.
be patients that, like, it's not safe for them to go under sedation or GA. I think at that point, then the x-rays probably aren't as important, maybe. I
Yeah.
don't know.
I think it's just, so
Case dependent.
case dependent.
Yeah.
I don't think it's a bad rule to have. I just don't think especially when you come back to New Jersey and into the States, you're going to, depending on your clientele, probably realize
you won't have to do
necessary.
That. And, it's not necessary.
But then also it's going to add to your day and the time too. Like, can you be as efficient still by doing that? And is the patient fasted? There's another risk there.
Right.
And I think at least for my team, if we have an orthopedic x-ray we have to do, we always sedate them.
Right.
Because the patient's usually painful and you need specific positioning. And so you just can't practically do that awake.
Yeah.
That's just not.
Any head stuff. I think that it's too hard if the animal's moving at all.
Yeah.
Your x-rays are blown.
Yeah.
I was also going to add, and when I was in college, which was like 4 years ago, we sedated every patient, taped them to the table, and had to process every film too.
Oh yeah, you did have to process every.
We had a dark room.
Oh my God.
Well, we
so even you say back in the day
here, we just started getting the digital.
Well, yeah, but we didn't have to process them. We had we just put the film into the machine. We didn't have like a dark room.
Didn't have to.
I had to put it through the thing, dip it in the thing, hang it up.
Yeah.
We had a dark room.
Yeah, it goes through.
Yeah.
It goes through, like the film you untake. So you go in a room. It's dark.
Yeah.
You open the cassette. You take the film out. You have to feed it into the
and make sure it's the right way.
Make sure it's the right way, and it goes in.
What are you looking at me for?
I don't know. I'm just
the processor. It goes in the developer, comes out into the dryer, and then comes out on the back of the machine, and then you could put it up. And
I feel like I would want to avoid X-ray as much as possible.
You have to, but there's a very faint, small red light. There was in ours, so you could see. You couldn't see, so you had to stand there for a second while your eyes got adjusted, so you knew where everything was. And if you missed or messed up one step, oh my God,
you got to go back.
I had to do that, and that was only 4 years ago.
That's a nice skill
IBC still has a dark room.
Great. No, it's not. It's like knowing the capitals now.
Well, yeah. What am I going to do with that?
That matters.
Well, that's what
it
I was
does
saying.
not matter. You can go look it up on your phone or your computer.
Yeah,
there's like
in
1 in
3 seconds. Who cares if you know the capital of
Massachusetts?
You know the states?
No, I don't know. Probably know all of them.
Alabama, Alaska, Arizona,
Arkansas.
Anyone know the song?
California,
Arkansas.
I'm trying to think. What is the capital of North Dakota? I think it starts
See?
with an R.
I don't know, but you know what I can do?
I think it starts
Siri,
with an R.
what is the capital of North Dakota? Siri, what is the capital of North Dakota? Still answering.
Siri,
she doesn't care.
What's the capital of North Dakota? Bismarck.
But see, but the dark room, there's probably 1 in a million clinics right now that have a dark room, and you have to process.
I bet there's
I bet there's a lot.
Oh, you think so?
I do,
absolutely. People are so cheap.
Yes, cheap. And just they,
then I wouldn't work at those clinics.
Slow to change.
I would not work in those clinics then.
Yeah. So okay, that's our other advice, Michelle. When you get out and come back to Jersey, don't go to a clinic that has a dark room.
No, get a clinic with digital.
When we got that digital X-ray machine here, I was like, whoa.
Yeah.
Because I don't know how we used to do it.
I don't know.
Because there would be 10 to 15 minutes in between each film because we'd have to put it in the thing. I'm like, what did we do with the dogs? Just let them sit there? I don't remember.
I think man hours.
Maybe we had an extra person.
Yeah.
So why we held it. That might have been.
A lot of man hours.
That digital extra thing that we got.
So
it's like Christmas morning.
Did everyone share their opinion on the question?
I think so.
Okay, great question.
Yeah.
Courtney, would you like if every animal was sedated? You're the technician.
It's case dependent because sedation is so time consuming, and I would not want to have to sedate every single animal that walked through the building that needed x-rays.
Yeah.
That's not feasible.
Yeah.
So our opinion is we would sedate animals that are painful.
Yes.
Too wiggly. That you can't get accurate films.
Too aggressive.
And
orthopedics, at least for me.
Yeah.
But no, I would not want to sedate every animal. It sounds nice. It sounds amazing that I could just lay an animal there, but that's
you still have to recover them.
Well, that's the thing. Is
it's
the
pre
and the post
full hour
sedation.
Yeah, hour or longer depending on how fast the patient wakes up. So no.
Okay, there we have it.
At least you can decide in the United States. So
that's right. Exactly.
You have the power.
The power. All right, Michelle, keep after it. Great question.
Yes, you're almost there.
And thanks for listening.
And send us a picture of Scotland.
I was just going to say, send us pictures.
Gosh.
Pictures.
It's one of my dream places to go. It's
very
amazing.
cool.
So
very cool. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
That was perfect.